Well, that particular night I was very restless. I couldn't sleep at all. It was like I wasn't getting enough oxygen, air, to breathe in, because I would get up and sit beside my bed and I had a throbbing in my head. Not a pain. It was just like a thumping. And I'm like, okay, Dorothy, I know your heart is not in your head. It was just like I had no energy, because every time I got to a chair, I would sit down, you know. And I'm like, okay, Dorothy, you gotta go. You got an appointment at 12:30. Get pushing. So at this point, I started getting nervous because my body was going through a lot of changes there, and I really didn't know what was going on, and I never felt like this before. And I looked out and I said, oh, good, my neighbor is at home. I called over and asked her to come over. I said, I'm not feeling well, come over. She said, I'm on my way. She came over. And at this time, I had really started sweating. Just water was just pouring off of me. She said, oh my God, you're really sweating. Says, I'm gonna get a towel. She went in the bathroom and got a towel and put it on my head. She said, why don't you just lie back and relax for a minute here? And I said, okay. And as I went to lie back, I couldn't breathe too good. I said, no, I can't breathe. She said, I tell you what, I'm gonna go and get my keys, my car keys, and drive you to the hospital. I said, no, you go in there and dial 911. I'm out of here. Something is going on wrong. I'd say within 5 minutes or more, they was there.
Dorothy, how you feeling?
A little nauseated.
Okay. Do you have any chest pain?
No.
Okay, well your vital signs look good, your blood pressure's a little low, but I'm going to give you some aspirin, okay? I need you to take 4 of these, you got to chew them. I think they're orange flavored.
They got me in, hooked me up to the EKG and everything, and so they was translating back to the hospital.
So we got a couple more tests to do with our heart monitor, and then we'll be on our way to Missouri Baptist.
So this is when they told me about the heart attack, and that's when I got really scared.
Okay, you're going to transmit an EKG? All right.
Miss Lewis, we started an IV in your arm.
I want to go to Missouri Baptist, so that's why they brought me here. This is my family hospital, my daughter, you know.
I think we have a STEMI coming.
Yes, I'd confirm that as a STEMI. Go ahead and activate the cath lab.
Okay.
Because the arteries have to be opened quickly to try to save lives in heart attacks, the American College of Cardiology, the American Heart Association, and other bodies have set a standard of 90 minutes from the time of presentation to the hospital to the time we open the artery of 90 minutes. So all hospitals are trying to get a so-called door-to-balloon time of 90 minutes.
We have a STEMI, you guys. They're coming straight from home.
At Missouri Baptist, we're able to pare down our door-to-balloon time down to about 60 minutes because we know that every 10 minutes we delay, the mortality rate can go up at about approximately 7%.
It's 2627. I have a 67-year-old female patient. She's coming from home, complaining of nausea and vomiting for about 3 hours now.
The evolution of the Heart LifeLine Alliance has been such that we started with our own emergency room and trying to really rapidly get patients coming to our emergency room into the cath lab as quickly as possible. Once we were very successful doing that, then we expanded it to rural emergency rooms so that the rural emergency rooms could get patients to us quickly. The very quickest way to get patients in the cath lab, though, is to have the EMS activate the cath lab. So when the EMS arrives at the scene and they have a patient with chest pain, a 12-lead EKG is done. The EMS providers, almost all of them now have 12-lead EKG capabilities and the skills to read them. We actually, at that point, asked them to transmit the EKG to our emergency room where it's read by one of our emergency room doctors, and if confirmed, at that point the cath lab is activated and we're all brought in and typically we're there waiting when the ambulance arrives.
Hi, this is Sue from the cath lab. Do you have an ETA on the patient? Okay, thank you.
We do educational programs for many fire services in this area. We go to the firehouses to make it more convenient for their staff to attend the classes if they can't get to the hospital. We have the classes 2 days a month, but I also go to the firehouses and do the classes. Many of these involve 12-lead EKG interpretation, pharmacology classes, cardiac emergencies, orthopedic emergencies. We have a wide range of topics that if they're interested in, we can provide for them, or topics that they are interested in that we don't have, we'll gladly put together for them.
Everything was moving fast, you know. I cannot describe all the things they were doing, but they was on their job.
We're at Missouri Baptist, Miss Lewis. Nice lady from registration out here who's going to ask you some questions. Here comes your boss.
Hi, Miss Lewis. I'm Sheena. I'm going to get you registered.
Cath lab.
This is the EKG you guys sent me.
Yes.
Mrs. Lewis, my name is Alice. I'm a nurse from Cardiac Cath Lab, and I'll be with you throughout the whole procedure. Please call me Dorothy. Okay, Dorothy. If you start having any chest pain, you need to let me know. You said you're just nauseated right now?
Yes.
You're going to be okay, all right? This is where I told you about.
As we worked to get Missouri Baptist accredited by the Society of Chest Pain Centers, we explored everything that we were doing in taking care of patients with chest pain, and in particular patients having a heart attack. We looked at everything from the process of them checking into the emergency room to how quickly the EKGs were being done, even to things as simple as making sure the elevator would be open and available for the patient getting up to the cath lab. We looked at how we do the catheterization on somebody having a heart attack. Which artery do we look at first?
You still nauseated?
Everybody was waiting for me when I got here. And everybody was moving around so fast, I could not say what. You know, they was working with me so fast. It was like every minute counted.
Dorothy, I'm going to be your cardiologist this morning. Are you still having chest pain now?
No, just nausea.
Okay. What we're going to do is put a catheter through your groin, take it to the heart, inject some dye, and find where the blockage
EMS has
is.
to know when they're picking up a patient that they're having a patient with an ST elevation myocardial infarction. And then the ER has to be able to recognize it and get the patient to the cath lab as soon as possible. And it's really a communication system between those areas of activity that allow a patient to be able to get from their home or wherever they happen to be when they develop their heart attack into the cath lab to be treated as soon as possible.
This has been like a 3 or 4 or 5 month process of training, exercising, doing mock scenarios, and then it was just a matter of waiting for the call to happen, and it did. So we were ready.
I feel great. I feel good. I feel as if nothing ever happened. They saved my life. They did a beautiful job.